absolutely painless. Thank you so much.
All right.
On Thursday, healthcare workers lined the hospital hallways, cheering as several colleagues received the first dose of Pfizer's COVID-19 vaccine in Kern County. Dr. Haydari, who is an infectious disease specialist at Kern Medical, says he wanted to receive the vaccine to send a message to the public.
I volunteered myself to receive the first vaccine, and the message is this is safe and we should go for it.
Jacqueline Law is the clinical director of the medicine specialty department at Kern Medical, and she's also the first nurse locally to be vaccinated, calling it a blessing. She says she isn't scared of the side effects. The only thing that she feared was getting COVID-19.
Yes, I am blessed to be the first nurse, registered nurse here in Kern County to get vaccinated.
Kern Medical received enough doses to give 1,125 vaccines to their staff, which still doesn't cover all healthcare workers locally. The vaccine will help with COVID-19 symptoms and slowing down the spread of the virus, but there isn't enough data to show whether or not it prevents the transmission of the virus to someone who isn't vaccinated. A total of 5 healthcare professionals from Kern Medical received the first dose of the vaccine on Thursday. The division chief of infectious disease, Dr. Royce Johnson, calling it a historic day as he received his vaccination.
Day is historic in the sense, to paraphrase Winston Churchill after the Battle of Britain, this is the beginning of the end. So I think it is, in that sense, a historic occasion. I think we have now developed the tools that will allow us to go forward to defeat COVID instead of it defeating our population.
Each doctor was monitored for 15 minutes after receiving the vaccine. One of them was Dr. Rasha Karan, who is an infectious disease specialist. She said that she felt no pain at all, and more than anything, she felt excited.
I think this is the beginning of the final stages, hopefully beginning of the end of this pandemic.
As for when sick patients and the rest of the public can get the vaccine, it's all based on a tier system. Around 3 million medical workers will receive it first to be able to help those battling the virus. Long-term care residents are also at the top of that list, but there is no set date on when the general public can get the vaccine. Dr. Karan also says that she believes the COVID vaccine may need to be repeatedly given to the population, just like a flu shot.
I think this is going to modify our lives in the future, but I don't think we're going to do the same strict precautions forever. Once the vaccines are implemented and hopefully the numbers are not a pandemic magnitude, then I think we're going to hopefully ease off. But we'll be more cognizant of how infections spread, I think, in the future than we have been in the past.